Hello, my name is Stephen O'Connor. I'm a staff attorney with the National Health Freedom Coalition and National Health Freedom Action. And today we're going to take an overview of health information exchanges. And so if you just give me a moment, I need to share my screen. Health information exchanges and your medical data. Today's February 3rd, 2026. So to get an overview, health information exchanges are basically a central hub for data storage and a clearinghouse of personal health information. And the double lines show that information goes from a provider, such as a hospital, to the health information exchange. And then perhaps at some point down the road you're seeing a doctor, and then the information goes from the information exchange to the doctor's office. And one thing we'll notice here is that information can go to public health departments, state and local, depending upon the type of information. So the health information exchanges, they have the personal medical information for a majority of Americans, and most of that is stored in the cloud. These are mainly nonprofit organizations, and they aggregate all patient health data from around 3/4 of U.S. hospitals, likely a majority of the larger integrated health systems, and as far as private doctors with their own office, information as far as their rate of participation is hard to locate. Health information exchanges are in at least 47 states. Now, just a side note that we'll come back to is that HIPAA, the federal medical privacy rules, allow sharing information for quote unquote business associates, and the health information exchanges are considered to be in that category. As I noted, they exist in at least 47 states. And essentially, they're clearinghouses and data storage centers for all participating healthcare providers and patient information in a given state or portion of a state. And one main reason for these entities is so that if you go to a provider 1 year and then you have health records, they go to the exchange, and then you see another provider a year or two later, and they can access your prior medical records in an easy fashion. Now, federally, there's an Office of the National Coordinator for Health Information, and they've created grants to support the creation and maintenance of these health information exchanges, and they also have some role in defining the legalities of what they are. Now, a huge privacy exception that applies to these health information exchanges is information that's deemed important for state and local public health departments. HIEs around the USA, how many and what is their structure? So one 2024 survey counted at least 76 health information exchanges in the US, with over 600 million patient records. Now that does include duplicates and overlapping records, because sometimes the exchanges are hospital system specific, region specific, or possibly even disorder specific. So that includes people whose records are being counted twice. But the bottom line is that most Americans have their health information stored at one or more health information exchange, and most people don't know much about the existence or functioning of these entities. They can be nonprofits, which the vast majority are. They can also be for-profit companies or public-private partnerships, which we could call quasi-governmental. This diversity in different types of organizations comes partly from a 2010 state health information exchange cooperative agreement program, which put about $580 million in grants towards this HIE infrastructure. And at the moment, many states have overlapping health information exchanges with some at the state level, some regional as noted, and some either disease or health system specific. Now, how does HIPAA apply to public health information and health information exchanges? So the HIEs do qualify as business associates, and the HIPAA privacy rules do allow them to disclose personal health information without consent for treatment, payment purposes, as well as many public health uses. Public health agencies are likely, it appears, the largest recipients of data conveyed over these HIE networks. And personal health information that can be shared for public health purposes without consent includes births and deaths, communicable diseases and related data, public health surveillance and investigation data, child abuse, FDA-related information about products and adverse events, notification to folks at risk from disease exposure and contact tracing, and last, workplace-related illnesses or injuries as required by OSHA. Public views on the HIE situation. Now, there is no easily available data as far as how many people know about the existence and the inside workings of these HIEs. And also, I want to note that health information exchange can refer to the entities that we're discussing, but it could also refer to the concept of sharing your health information electronically. So on this on the meaning of on this latter meaning, one study has showed that about 70% of people were very or somewhat concerned about privacy issues around the concept of health information exchange, and about 75% of folks felt the same way about HIE data security. Other research from 2024 shows that while most people support the idea of HIEs when it comes to having their data shared among their different providers, a lot of people have concerns about use for research or public health, especially when there's a lack of transparency about these uses and when folks' data is not anonymized. Can you opt out of HIEs? One thing to think about is that the information exchange, it's a two-way street. So you have information going from providers to one or more HIEs, and then you have information from HIEs going to, for example, another provider. And there's no real way to opt out of the first step, information going to the exchange, if that's the way the hospital or doctor that you're seeing operates. So when we talk about opting out, we're talking about opting out of the exchange sending information out to another provider, public health department, any other source. So that's what we mean about opting out. And now it varies state to state, and even if you choose to opt out, that basically impacts providers, and you generally cannot opt out of public health uses that are allowed by law. And for one example, if we look at California, there's no state opt-out law, and each HIE in the state sets its own policies. The biggest HIE in California, Manifest MedX, has an opt-out form that makes clear that it only applies to personal health information accessible by your healthcare team and your health plan, as opposed to these other uses such as public health. Now, Arizona, another example, has a specific state law allowing you to opt out, but this does not prevent the HIPAA-allowed public health disclosures to, in that case, the Arizona Department of Health Services. New York has one of the public-private partnerships known as the Statewide Health Information Network of New York, and it's one of the few, if not the only state that effectively has an opt-in system for basically, so if you go to a new provider for that provider to access your data from a health information exchange, you have to sign a specific consent form. So effectively, you have to opt in to the new doctor being able to access your personal records. And again, at the same time, your consent is not needed to share information for public health purposes. And then lastly, for more information or to get involved in these issues, there are several groups that are working specifically on health information exchange issues and protections. So as more health providers participate in these and consider participating in these HIEs, we all need to be informed and involved as to whether to use these systems and how to manage them in a way that both allows technological progress but is consistent with our long-term values in terms of health privacy. So three of the main groups that are focused on this issue are Patient Privacy Rights, the Electronic Frontier Foundation, and the Privacy Rights Clearinghouse, which you can look up any of these groups on the internet. And they all have concerns about privacy, surveillance, patient consent, data security, law enforcement access, and potential mission creep, meaning once we have all this infrastructure established, can these exchanges be used even for more purposes beyond public health? And so that is our overview of health information exchanges. Here's our contact information for National Health Freedom Coalition and National Health Freedom Action. And I want to say thank you so much for your time and wish you a great day.